Hello, my name is Dr. James Greening. I'm a consultant paediatric endocrinologist who's been working at Leicester for over 15 years now, and my private practice is at the Spire Hospital in Leicester. I'm tertiary trained, see a range of patients with endocrine conditions. So we talk about with diabetes having the 4Ts. It's a simple way to remember it. These are the effects of having a high blood sugar, is that you have, first of all, thinness, so you lose weight. You have tiredness, and you also have thirst, so you drink too much. And then you have toilets, so that is going to the toilet too much. These are the cardinal signs of diabetes because you have your sugars too high. I've been asked if you inherit the risk of developing diabetes. This is a difficult question because there is a genetic component to it, but we really think of diabetes being what is a multi-hit disease. So you inherit a risk for developing diabetes, but the risk is still quite small. It's about 1 in 250 people in their lifetime who have a risk of developing diabetes. But that means plenty of people will never go on to get diabetes, even though they've inherited the risk. In fact, about 9 out of 10 children who develop diabetes will never have had any family member with diabetes in the first place. But if you do have a member in your family who has got type 1 diabetes, your risks are higher. So if we delve a bit deeper into the reasons behind this, is that the risk for you developing diabetes is actually a risk for your immune system to be switched on. The immune attack is called autoimmunity. It's where your own immune system attacks yourself. And in this case, it's attacking the cells which make insulin. Over a period of time, the immune system destroys all the cells which make insulin. And as you know, insulin is the reason that you can keep your blood sugars under control. At a certain point, you reach a tipping point where there is no longer enough insulin around to control your body's blood sugars. And then you develop those 4Ts that I've spoken about before. Unfortunately, at this stage, we don't have a way of stopping this. So once you develop the symptoms, it's inevitable that you will need to be put on insulin. So as I've alluded in my last question, is that once you don't make enough of your own insulin to control your blood sugars, you have to get that insulin back in another way. Now, insulin is a very fragile medicine. So actually, we can't give it as a tablet or as a patch. It has, unfortunately, to be given as an injection because the insulin needs to act quickly and go into the bloodstream. So we give insulin into the blood. At the moment, the most common way to do this is by having injections of insulin every time you eat, and also once during the day to cover you for your daily needs. Or you might have the insulin given via an insulin pump, where instead of having to inject yourself 4 times a day, there's a continuous infusion of insulin going in via the pump. So these are the 2 choices that you have. I've been asked, and frequently asked by many parents, is there a cure for type 1 diabetes? Now, 15 years ago, the answer would have been simple, no. But things have changed. Science has moved on, and we are now just starting to see the beginnings of research studies looking to how we can change the immune system. Remember, I told you the immune system attacks yourself and destroys the cells which make insulin. And there are now new therapies coming on board, which are starting to alter the body's own immune response and stopping it from attacking the cells which make insulin. It's not true to say that this is an absolute premature at this point because it's the very early stages of research, but we're starting to see treatments such as plizimab, which is a monoclonal antibody which alters your immune response. In patients who've been given this monoclonal antibody, it's actually delayed the destruction of the last few cells which make insulin, and actually has improved patients with diabetes control. Unfortunately, at the moment, where these research studies sit, is that we are still looking at patients needing insulin. But in the future, we will get better at this, and we would hope that we would have treatments which would actually stop the onset of type 1 diabetes. So as I've said, we are at the moment stuck with having to treat diabetes with insulin. So the main aim of what we do is we're trying to copy as best we can what a person with diabetes, somebody who doesn't have diabetes, how they make insulin. So we try and mimic what the cell would, the body would be doing anyway. We have insulin to give as injections, and we are now trying as best possible to get that regime as close to what the body needs. So the minimum requirement with injections is that you have 4 injections a day at least, and you inject insulin every time that you eat food. And also, if you were to have a snack, you would need an additional dose of insulin. There was a trial about 25 years ago, which showed us that the more intensively you treat yourself with insulin and get your sugars under control, the better it is for you in the long term, and the reduced risks of getting complications with diabetes. And that really has been the mainstay of treatment. So when you come to clinic, you'll see that we're always striving to get the best possible control with your insulin doses. So that covers injections. But in the last 10 years, insulin pumps have become a lot better and a lot safer. And now many of you will be moving on to being on an insulin pump. The reason for this is it gives better control within the injection regime. You can much more closely mimic what the body needs and bring down your average sugar level, so it's nearer to what the body actually would normally have. In the last 5 years, we've seen the technology move on still further, where you can actually have a glucose sensor which talks to the insulin pump and automatically adjusts the dose of insulin according to your body's needs. Using these systems, we've seen a further improvement in your overall control of diabetes. And actually, really, the story has moved on now, not just for us to get a good control of your diabetes, but to actually get physiological control of your diabetes. We're not quite there yet, but these new systems are getting closer and closer to this requirement. If you come to clinic, for many years, we just used to talk about what your average blood sugar was over 3 months by a blood test that we did when you came to clinic called an HbA1c. We still use this, it's very helpful, but we're now starting to look at what is more physiological. We'll talk to you about how much your sugars go up and down, or the glucose variation, and also the time in range, the time in which your blood sugars are within the normal range for a non-diabetic person. Because we are striving to get sugar control closer and closer to what the body actually needs. So if you are thinking about a pump, or you're already on a pump, you will have these conversations with your doctor about how you're going to optimize your care. The main reason for this, simply put, is you want to get the sugar in your blood vessels down to a normal level, because sugar in the blood vessels which is too high is dangerous. It causes inflammation on the surface of the blood vessels, and this is what causes your disease in older age. So we don't want that. We want you to live a fit and healthy life until your old age without complications with diabetes. So sometimes you may think that it's being hard on you, but actually what we're trying to do is to get your sugars as best as they possibly can be, so that you don't have complications from diabetes. Again, this is a question about lifestyle and diabetes. It's often asked when one thinks about the difference between type 1 and type 2 diabetes. You have to understand that there is a distinction in that type 2 diabetes is much more often related to lifestyle changes and being overweight. Type 1 diabetes really is not related to this because, as I've alluded to, it's caused by the immune system misfiring and attacking one's body itself. Although lifestyle is important, it's not as important as what we tell you with type 2 diabetes. And in fact, what we try and do is make sure that you fit the diabetes into your life. And the mantra that we use is that we aim for you to control your diabetes and not for the diabetes to control you. So the dietitians, they will in clinic be very much teaching you healthy eating and a healthy lifestyle, so that you can fit that into your diabetes. It's true to say that you will make some changes to your diet. That's quite natural because you're striving once again to get as good sugar control as you can. And one of the ways that you can do that is actually to use your diet. But often it's just more simple for you to actually match your insulin requirements rather to make wholesale changes to your diet. And actually, you will become an expert in your diabetes. I often say patients with diabetes, after they've been diagnosed for more than a year, no more than most doctors. Hopefully not more than me, because I'm a specialist in diabetes, but you really will know what your body does with your blood sugars. And we will help you become an expert in how to control your diabetes.